Students, let's go back to our lecture. And so this is about the, let me see that, let me see. This is about the cardiovascular system. And so we will use two lectures. Let me drink something first. We will use two lectures to talk about it. So the first one is this one, and then we'll do the next one later. So cardiovascular system, just by name, you know it's about the cardio. So this cardio is heart, right? Cardio, heart. Vascular is about the vessel. So this is a blood circulation. This is a good extension from our muscle cells. So remember that the sequence that we design, we've been go through these course. We first talk about cells, then talk about excitable cells. With the excitable cells, they are nerve cells, muscle cells. We first talk about nerve, then we talk about sensory, motor nerve, then we talk about the motor, then talk about the muscle. We talk about the skeletal muscle that connects to bone. And then this one is also muscle, that is cardiac myocyte, cardio muscle, heart muscle. We will also use vasculature to talk about smooth muscle. So we basically that will complete everything. We talk about the skeletal muscle, heart muscle, and smooth muscle. Those are the three types of muscle in our body. All right, so we will talk about these two. So heart, human heart has 4 chambers. So what you need to know is the basic anatomy. And so you need to know there are 4 chambers. You need to know atrium and the ventricle, right atrium, left atrium, right ventricle, left ventricle. When you look at the slides or image like that, you basically, what's left, what's right, you basically looking at patient. So this is your patient, that is his heart or her heart. So the right side is basically the patient side. That's right side, left side, atrium, ventricle, atrium, ventricle. So how do they connect? You need to know how do they connect. So basically that the atrium will bring blood into the ventricle, and there is a valve. In the right side is called tricuspid valve that prevent the backflow of the blood. Then the ventricle will bring the blood to the artery. In the right ventricle, it brings blood into the pulmonary artery. Then pulmonary artery will go to lung, coming back to the pulmonary vein. It will enter into the left atrium. Then atrium squeeze the blood into ventricle through a valve. This is called bicuspid valve. In the left side is bicuspid or mitral valve. In the right side is called tricuspid valve. And then the ventricle will then squeeze blood into the artery. In the left side, it squeeze blood into aorta. Aorta will bring into the systemic circulation. This blood will have many branches. Then it will bring the blood into our body, provide the oxygenized blood into our body. And then body receive those oxygenized blood, then use those oxygen, and then oxygen for what? To produce ATP. While producing ATP, it will also produce CO2. So we need to get rid of the CO2. Those low oxygen and the high CO2 blood will go in from the body into the veins, and then through the vena cava, superior vena cava or inferior vena cava, and then go into the right atrium. And then that's a cycle. Systemic circulation begins from the left ventricle through aorta to the body, coming back into the vena cava and at right atrium. the pulmonary circulation begin at right ventricle, go through the pulmonary artery, pulmonary capillary, get the oxygen. And then this oxygenized blood goes through the pulmonary vein to the, and so that pulmonary circulation ends at the left atrium. So that's the cycle. All right, so you need to know these chambers, how do they connect? And also you need to know what are these vessels connect with the chamber. Quiz question can be, when left ventricle squeeze blood out, which artery or which vessels received blood from the left ventricle? You need to know that is aorta. Which chamber, right atrium received blood from where? From the vena cava, so something like that. Every chamber connect with vessel and also connect with another chamber. So that basically each chamber has two outlets. One end has the blood coming in, the other end has blood coming out. So that's that, and the chamber doing the contraction. So you can see that this heart basically is a contraction machine. It's a pump. And what muscle, what cells in our body doing that movement is the muscle cells. So why do we call these muscle cells? Muscle cells conduct mechanical movement. So your other cells they can move, but they don't really provide the force for body movement. Those cells conduct the body movement are muscle cells. So here you can see that this heart basically is a group of muscle cells. So we will need to, in order to know the heart function, we need to know about these muscle cells. So this is what we have talked about. Circulation, systemic circulation start from the left ventricle. You don't need to worry about this number. You just copy from the textbook. Yes, this number represent how much blood in those circulation, but you don't need to remember those. What you need to know is that their connections is system. So systemic circulation coming originate from the left ventricle through aorta, then that goes through the body, go to different organ, coming back into the vena cava, getting back to the ending at the right atrium. And then the systemic circulation immediately connect with the pulmonary circulation. This is the oxygenized blood, low oxygen blood. It will bring from the right ventricle. So you can see that ventricle is the driving force of each circulation. Left ventricle is the driving force for systemic circulation. Right ventricle is the driving force for pulmonary circulation. So this blood will go into the pulmonary circuit, pulmonary capillary, receiving oxygen. You bring oxygen, get rid of the CO2. So here you have the fresh blood. Carry a lot of oxygen with very little CO2. This blood will coming into the heart to the left atrium. So that is the pulmonary circulation. All right. So in order to know, so we will start by looking at the heart. In order to, okay, I want to talk about the heart, but another thing is that while we talk about this circulation, aorta provide, so here is the oxygenized blood coming here. So aorta provide all our body oxygenized blood. So aorta is the largest artery. And so and it has multiple branch to different organs. You took the anatomy before, so you know that these different artery system. And the important one that I want to emphasize has several, but I think the only one we probably will only talk about with this one is the one that supply the blood to the heart organ. So from the artery, when you write immediately, for the aorta, when it leave the the uh, the uh, left ventricle, it immediately branch to provide the blood supply into the heart organ. This branch is called coronary artery. So coronary artery is the artery to nourish the heart organ. So that's a quick question you're gonna see. It's important because coronary artery occlusion or coronary artery disease is the primary cause of heart failure or heart disease. When you have this coronary artery, if there's any blockage, you reduce the blood supply into the heart. Your heart wants to work, but it doesn't have enough oxygen. It doesn't have enough fresh oxygenized blood to work. So heart will have reduced function, basically gradually lead to heart failure. So that is important to know. Coronary artery is the artery to supply the heart organ. You're gonna see this in the quiz question. Which artery supply the blood for heart organ? That's the coronary artery. All right. All right, here we go, muscle. So we talk about the skeletal muscle. We talk about muscle basically, and we know there are three types of muscle: skeletal muscle, heart muscle, smooth muscle. You know that skeletal muscle is muscle connect with skeleton bone. Heart muscle is the muscle of the heart. These two type muscle has something in common. Those two are all called striated muscle. So they have myosin acting all aligned very well with Z lines, M lines, A band, I band. Yeah, so you should know that already. All right. So these muscles are I just made a little bit editing. I had one slide that it shouldn't be there, so I deleted it out. All right, so we start from here. So this is a heart blood supply. That's the coronary artery. Let's talk about the heart muscle. All right, yeah. Sorry, that's some editing issue. All right, so this is one we want to talk about. Yeah, striated muscle. I want to show this one here. So it's very much the same, very similar, like skeletal muscle. And so as such, you know the contraction mechanism or contraction process will be identical with the to the skeletal muscle. You have myosin, you got to have calcium. What's calcium for? Binds on the troponin, and then it will remove the tropomyosin, myosin, and the actin bind, and then you can have a contraction, right? So you know the drill, you know how things work. And we have the same thing in the heart muscle, right? So, but all right, so they are all the same. So what's the difference? The major difference, the primary major difference, there are two major difference. One is that we're going to talk about, which is that this heart muscle has gap junction. Why is it? Is that here is one cell and that's the other cells. These two has channel to share, to connect with two cells. And so you can see here you can see that this is gap junction. So this is one cell and this is another cell. And so you have this gap junction. Gap junction allow ion to diffuse across, just like a ion channel. All right, just we can see this one, this as an ion channel, and that is another ion channel. So these two ion channels just connect with the other, just like, yeah, just like mouthpiece, something like that. Yeah, so connect with each other. And with that one, any ion will freely diffuse from one cell to the other. So with this gap junction, ion can diffuse across. What's the consequence of it? The consequence is huge. Now, for the skeletal muscle like this one here, when you do muscle movement, each muscle are separate from the next muscle. So each cell is separate from the other cell. So when you excite one cell, it will not affect the neighboring cells. However, in the heart, the gap junction will allow ion to diffuse, to spread across each chamber. So this is the chamber right here. So this is right atrium. It has a lot of muscle, right? And these muscles share their environment, their intracellular environment with the neighboring cells. So when one cell got excited, action potential will travel through the next cell, through the entire heart chamber. So the entire heart chamber will get excited, which is very different from the skeletal muscle. When you move one muscle, you are not going to move the whole thing. Otherwise, you cannot do fine movement, right? So you only excite cell specifically, but in the heart different. In the heart is that you excite one cell, then the entire chamber contrast, get excited, so they can contrast all together. So that's the beauty of the gap junction. So that's that. So it has this gap junction. So action potential can travel easily from one cell to the next cell. And the consequence is that the entire chamber, not the entire heart, because there are some septums, some fiber to separate each chamber, but the entire chamber will get excited all together. And so they can synchronize their contraction. Yeah, so that's one thing. The next thing is their action potential are slightly different. So let me show you this one here. We talked about this one, and I draw this again. You guys are the first one to see this picture. I feel this is awesome. I like it. All right, let me show you this one here. So here we have cells. Let's see how cells evolve. How about that? So this is a cell. This is every human cell. Every cell has this. Has what? Has this. This is a membrane protein. It's sodium, potassium, ATPase. So every cell has it. Human body, every cell has it. With this one, it will pump 2 sodium out, sorry, 2 potassium in and 3 sodium out. So you pump 2 potassium in, inside we will have a lot of potassium. I don't know if I can draw anything like that, but let me try it. Draw it. Tool, maybe. That's all. All right. So here you have a lot of potassium because this one will pump 3 sodium out, right? And what? And 2 potassium in. Yeah, so that's that. Yeah, here we go. All right, so that is, and with this one, you will cause the intracellular amount of potassium, and you will also cause the membrane potential to be negative, right? Yeah, I think that's recipes of it. So inside will be negative. So that is every cell has it. Now, with excitable cell, what are excitable cells? Muscle cells and the nerve cells. So with this excitable cell, it will have this because every cell has it. But in order to become excitable cells, you need to have two additional membrane protein. So these two additional membrane proteins are this one and this one. That is voltage-gated sodium channel and the voltage-gated potassium channel. With this one, you can generate action potential. So here we go. I need the pencil again. So where is that? Yes, I think I have it. I have it. All right, here we go. Here we go. So you can generate an action potential. Action potential. Yeah. And then this one is caused by depolarization, caused by voltage-gated sodium channel open. This one is repolarization caused by voltage-gated potassium channel open. With these two, you can upgrade it to become excitable cells. Who are the excitable cells? Muscle cells and the nerve cells. We saw this in the nerve cells. These two chambers, two membrane proteins are primarily located in the initial segment of the axon. So it makes the nerve to be excitable. It can generate action potential. All right, so that's all good. Now, with the heart, it's an excitable cell because it's muscle cell. It's excitable cell. But in order to become a heart muscle cells, you need to further upgrade it. You need an additional thing. That additional thing is here. Here, this one here. So muscle cell is every cell. So it has the sodium potassium pump. Is excitable cell. So it has the voltage-gated sodium channel and the voltage-gated potassium channel. But it has one extra tool in its toolbox. It has one extra membrane protein in the membrane, cell membrane. That is this one here. It has a voltage-gated calcium channel. So with this one, it make the action potential be like this. So let me draw here. Tool here. So it's it has depolarization because where is that? Where is oh here. So it has depolarization because it has a voltage-gated sodium channel. It also has repolarization because it has voltage-gated potassium channel. But between these two, it has something called plateau. Like this one here. Like this one here. So its action potential is like this. It has a depolarization caused by voltage-gated sodium channel. When the membrane potential, when it opens, sodium comes in, making depolarization. Sodiums come in. Here is the sodium. So this is sodium. Right, so this is sodium. Sodium can freely diffuse, but it moves from high concentration to low concentration, so sodium influx, it will cause the inside to be more positive, so membrane potential increase. This is called depolarization. It's caused by the voltage-gated sodium channel. And when the membrane potential become neutral, you will have a slow and prolonged opening of calcium channel right here. We call this phase a plateau. And during this time, the membrane potential remain to be positive because you have slowly opening of this calcium channel right here. So that is this one here. This one. So this one will open. This one will allow calcium to diffuse across, and it will diffuse from high concentration to low concentration. And the inside is the only thing high in intracellularly is potassium, So calcium, the net effect is coming in. So it will maintain the positive inside. And after about 0.2 seconds, so it's very long. 0.2 seconds is consider the action potential. If we consider action potential, that's pretty long. So it has very long duration of calcium. This calcium is important because this calcium influx will allow muscle contraction. So during this time, calcium will coming into the cell, and while calcium coming into the cell, it will bind some troponin. It will allow contraction. So muscle will contract during this time. It's about 0.2 seconds. Yeah. So when calcium coming in, action potential remain to be positive. Muscle has the calcium that it needs for contraction. And then it will close. Following that will be the potassium channel open right here. Potassium channel open. Potassium can freely diffuse across, but the net effect is from high concentration to low concentration. So the potassium has high concentration inside of the cell, so it will diffuse out from high to low. So it will bring positive charge ion to leave from the cell. So it will make the memory potential to be negative again. So this is repolarization. And this is contributed by the voltage gated potassium channel. So that's that. So it's just an additional, an upgrade from the normal muscle cells. Skeletal muscle, you have excitable cells, but with the heart muscle, you need one more membrane protein that is voltage gated calcium channel. Why do we need that? Why do you need to have that? Why do you need to have that to have a healthy heart? Because you have it, so you have a prolonged action potential. You also have it, so you have calcium coming in to cause muscle constriction. And with this one, you have control duration of the contraction. In the skeletal muscle, we learned that you have fast twitching muscle, slow twitching muscle, some muscle calcium influx faster, some muscle calcium influx slower. But for the heart, it's all designed. You cannot have some muscle contract faster, the other one slower. You have to contract at the same time. You have to get excited at the same time. You have to have set plateau for calcium coming in, and during that time you can do contraction. So that's that. All right. So this leads to the action potential. This one is summary what we just talked about. This is the action potential, and you can see that during the depolarization phase, you have sodium channel open, voltage gated sodium channel open right here. Voltage gated sodium channel open, sodium influx inward moving into the cell. Then you have a plateau right here. Is a calcium channel open, calcium get into the cell. Then you have the repolarization, and that is the potassium get into the cell. And then you voltage gated potassium channel will close. With this one, you will have just a normal sodium potassium pump. Keep pumping potassium in, sodium out, and to maintain a negative resting memory potential. And so this is the action potential of the heart. With this one, you will also know that it has long plateau. You also know that during this time, during this phase, right, during this time, calcium get into the cell. With that calcium, it will bind some troponin to cause muscle contraction. So muscle contracts during this time. Yeah. All right. And the quiz question would be, what depolarization, what contributes to it? Plateau, what contributes to it? which ion channel contribute to it, and the repolarization, which ion channel contribute to it. All right, so that's that. And as I mentioned before, that the heart has gap junction. So this is basically what's going on with the heart. This is different from the skeletal muscle. It doesn't have the gap junction, but now you have the gap junction. Gap junction is also a membrane protein. So it allows ion to free diffuse. When you generate action potential of one, it will spread and cause the other one to have action potential, to cause the other one to have action potential. So everybody will have the same action potential. Everybody during that plateau, calcium will go into all of them. All of them will do contraction. You have muscle contraction, you have the functional, healthy heart. So that's that. All right. Yeah. So after knowing it, we can basically, that is the most fundamental part of the heart muscle. After knowing this, you already basically finished this lecture. Yeah. But we still have something to talk about based on this. That is the foundation. You know this, you know everything already. All right. So this lead to, if we kind of like step back a little bit, now we know each cell's function. Now we know that they all share their environment and they will contract together. So we can know that the one heart chamber has a synchronous contraction. Their contraction are synchronized. And we call these a functional sensation. So each chamber has its functional sensation. Each chamber has its functional sensation. And so this one is locally is collaboration. This one locally is collaboration. This one, you have 4 chamber, each one contrast synchronously. But how do we put them all together? The thing to put them all together is an electrical conduction system. So we will have a wire on the SA node to both left and right atrium, excitant, contrast, and then to the AV node to both left and right ventricle, excitant to contrast. So they will contrast in the sequence like left and right contrast together to left and right ventricle contrast together, and then squeeze the blood out. One is going to pulmonary, the other one is to the systemic circulation. All right, so let's take a look at this electrical conduction system. That is this one here. You have the pacemaker SA node to generate repeated impulse. And so when you generate action potential, it will spread to both left and right atrium. So both left and right get excited, contracts together. It will squeeze the blood into left and right ventricle. Electric signal will go through the AV node, go through the bundle of His, left and right bundle, and then Purkinje fiber to left and right ventricle. This will take a little bit time because you need to have atrium contraction first, and then you don't want to excite the ventricle too quick. You want to excite them after that 0.2 second of the atrium action potential. And so it will take about 0.2 seconds to reach the left and right ventricle. Then left and right ventricle excited, get excited all together, and then it will contract together. So this is so each chamber is a functional sensation, and but their function, each of them, how do we coordinate them all together? We coordinate them by the conduction system. From the SA node, this conduction system has a sequence. SA node to left and right atrium, then AV node to bundle of His, left bundle, right bundle to Purkinje fibers, and then to left and right ventricle. So that's that. So that's it. You know, that's just heart function. Atrium has this action potential. Then let me draw it very quickly. Cool. Yeah, I already have it. Yeah, I think it's that one. All right. So over here. So atrium both will generate action potential. Left and right generate action potential. And then after that, you will have, during this time, you have atrium, both left and the right, atrium contraction. And then you have a signal from the AV node to left and right ventricle. So left and right ventricle, I think I probably can change color, I hope. Where is that? Oh, I'm not so sure if I can change color. I don't know. I don't think I can change color. All right, it's okay. It's okay. All right. All right, I figure out I probably can use this one. So I will try this one. All right, here we go. All right, let's try this one here. So let me see. Yes. Here we go. All right. So let's say that left and right atrium generate an action potential. So it will generate action potential like that. All right. Right. So this one is left and the right atrium. They will contrast during this time. So both left and right atrium will get contrast during this time. And then signal will transmit into left and right ventricle. It will cause action potential in both left and right ventricle. And then left and right ventricle will generate action potential. But let me change another color. Like here, I can change color now. So let's say this is left and right ventricle. So left and right ventricle will generate another action potential like this one here, like that. And during this time, the ventricle left and the right ventricle will contrast. So that's the sequence. And then you have the resting. So let me choose another color. This resting color. What would be the best resting color? How about this? Resting. Here we go. I like this. Resting. And then you rest. And then you have another impulse, SNO, send signal to both left and right again. It will send signal to both left and right. It will excite both left and right. So you will have left and right action potential again. And then followed by the AV node then send signal to both left and right ventricle. So you have the left and the right ventricle action potential again, right? And then is relaxation, something like that. So here is the trigger. This one is triggered by the SNO. And this one is triggered by the kind of like AV node, but it will take a little bit long time. So SA node with is the initial, is the beginning, is a pacemaker. So SA node sends signal to left and right atrium, atrium potential, left and right atrium contrast. AV node, send signal to both left and right ventricle, action potential, ventricle, and then rest. Then you have another impulse here, SA node. And so what's your heart rate? Let's say 60 beats. Let's say if your heart rate is 60 beats per minute, which would equivalent to 1 beat per second. And so this is your heart rate. So this heart rate is the duration from here to here is about a second, right? So every second there's an impulse. Every second you have an impulse. So you measure your heart rate is 1 beat per second. And so basically that you will have the beginning here is 0.2 seconds. That is the atrial contraction, both left and right contrast. Squeeze the blood into left and right ventricle. Then left and right ventricle will contrast for another 0.2 seconds. Contrast. And then squeeze the blood into the pulmonary circulation and also systemic circulation. And then rest. So you can rest. The heart will rest for about, where is that? Here will be about 0.6 seconds, right? And then you have another heart. So this is kind of resting. Your heartbeat is 60 beats per minute, and so a beats per second. So this is what's going on. But you can increase your heart rate. Say you are exercising, right? When you are exercising, your heart rate increase. So it's not that 1 second long anymore. It can be shorter. So maybe you will have the second heart rate faster right here. And so, or here, right? Getting shorter. When it's getting shorter, you basically will reduce these resting time. And then you have the faster heart pump, right? So that's that. All right. That's it. Let me close everything. I need to erase it. All right, so I can do that. All right, yeah. Yep. So this is the action potential coordinate with the chamber contraction and also the sequence of chamber contraction. You have left and right contrast together, followed by left and right ventricle contrast together. And so basically this is what we talk about in the next. This one here. So you will have conduction system, the SA node, that's a pacemaker. It will send signal to both left and right atrium. And then AV node will go through the bundle of his bundle, left and right bundle, and the Purkinje fiber to left and right ventricle. Right. So here is we talk about. So the conduction system will synchronize left and right atrium and the left and right ventricle. Each one is a cessation. So SA node sends signal to both left and right. It contracts together, sends signal to the AV node, right here, AV node, then sends signal to both left and right ventricle, contracts together. So the contraction sequence is left and right contracts together, followed by left and right ventricle contracts together. All right, the next thing we are going to talk about is ECG. Let's take a break, and then we come back to this one here.